What's up with our medical system is the question I want to ask today. Do you feel like our medical system is actually supporting you, your clients, your patients in the best way possible? I believe that there are some really dramatic changes that need to happen with that. And I just wanted to explore a little bit with that. I'm Dr. Rita Marie Loscalzo. Welcome to the channel where we help people to overcome health and wellness challenges and become the healthiest version of themselves that they can, balance their hormones, get their digestion in order. And we also train the practitioners, if you're a health coach, a doctor, a nurse, whatever, to have the tools to actually help people get well. So here's the deal. Every week, I talk to people in my community, my friends, my family members, but I also talk to a lot of people who are in our health and wellness programs, our membership programs. And just when I think it can't get any worse, it gets worse. And I hear horror stories about people given wrong medication doses, about a child, 50-pound child being given a full adult size, the highest possible adult size dose of an antibiotic, and then having worse symptoms after than she was having before. I hear about people who are told, no, we're just going to cut it out without doing proper testing. People who are told, oh, your thyroid is attacking itself. We just need to cut it out and then we'll put you on medication. That's not okay with me. That standard of care is not okay with me. And if it was happening every now and then, if I was hearing about these things every now and then, I wouldn't get so up in arms about it. But it's frustrating and I believe it's tragic when people are given wrong advice, when there are ways that people can be given suggestions, that people can be talked to about their lifestyle and they can get well, and they're just not given that information. And I'm not necessarily blaming the doctors because it's what they were taught. They weren't taught that what you put in and on your body makes a difference in your health, your exposures, your foods, your attitudes, your thoughts. And we need an overhaul of this healthcare system. We need to move from a system where we're suppressing symptoms, where we're cutting out parts that are supposedly diseased, rather than really looking at what is the root cause. What is causing? And it's usually not one root cause, by the way, it's usually multiple root causes. But what are the causes? How can we support each and every person to make the choices in their daily life to support health rather than disease? And when things happen, when there are symptoms that come up, and you're feeling like, I need to go to the doctor to have this taken care of, you should be able to go to a practitioner who's going to ask you the right questions, ask you questions about your diet, ask you questions about your exposures, your traumas, your attitudes, and help you to put into a place a plan that's going to support you in getting well. I've said this over and over again. There's no one size fits all program, health program. There's no one size fits all diet that works for everybody. Last week we talked about there's no one size fits all fitness program. Everybody needs to be adapted to where they're at right now. Your fitness program, your food program, your supplementation program, all of those things need to be adjusted for you and where you are right now. And my dream is a healthcare system that's a true healthcare system. I wouldn't even call what we currently have a healthcare system. I'd call it a disease management system. When we have a true healthcare system, everybody's going to be trained in getting to the root causes, in teaching people how they can shift what their choices are on a day-to-day basis in order to become healthy, whole, and happy. And we all want to be healthy, whole, and happy. I believe maybe there are some people who don't, but most of the people I meet want to be healthy, whole, and happy. We don't want body parts being pulled out. I've lost body parts over time when I was very young. Imagine what my health would be like now if I didn't lose some of those body parts. I don't want to think about it, but because I've made choices since then. I've adjusted for my genetics even before I knew what my genetics were. I assumed I had bad genetics because there were no old people in my family. So I made choices. I gave up things I liked, but I took on things I like now even more because I know that when I eat certain things, not only does it nourish me, but it supports me and it's delicious. So I'm here to support you if you're a health practitioner. And I'm so excited about this that I'm actually doing a free challenge the next 4 days, 3 days in a row, Friday, Wednesday, Thursday, Friday, starting at 9 a.m. And I hate 9 a.m., but it was the only day I could fit in. So I'm sacrificing myself and starting these things at 9 a.m. my time, Central Time. And if you're on the West Coast, it's going to be even earlier. The good news is we're going to be doing this and broadcasting live on Facebook in a Facebook group. So if you go to the link that I'm going to put into the comments and you go and sign up there, you're going to get immediate access to a workbook I put together. And we're going to be doing trainings every day for those 3 days. And on Saturday, we're going to do it later. And it's going to be 90 minutes. And we're really going to pull it all together and give you a process for moving forward, how you're going to help clients, how you're going to help your patients, how you're going to improve your practice by putting into place these things. What do you need to know? We're going to be sharing a lot of it in these 3 days. And I hope that you can join me because I can't do this alone. I can't overhaul the health profession, the broken medical system by myself. There's just so many people I can reach. I want to do it through you. And that's why I'm doing this training over the next few days. So go into the comments below and look for that. And if you're interested and you don't see it, just type it in and I'll make sure that, me or somebody on my team comes back and puts that link in. And here's the thing, people say, is it recorded? Whatever. There's a process here. It's free, absolutely free. It's going to be broadcast in the Facebook group. If you can't make the actual live times, no worries, because the way that the Facebook group goes is it saves it for later, basically. So it's going to be replayed and you'll be able to go in there. Now, if you sign up for this, then you're going to get the workbook. If you go to the link that I gave you, you'll get the workbook. Okay. And there'll be an option if you want to pay a few dollars extra. We'll actually send you the recordings after the fact. So if you can't make most of the days, no worries. You'll be able to get access to it. You'll be able to incorporate there. Plus, if you sign up for the Backstage Pass, that includes the recordings, you're also going to get to stay a little longer and go into the back end where I can work with you directly. And it's a Zoom room. And there's, it's a lot less people doing that than doing the full thing. So you get a lot of support. I want to help you. I am so tired of hearing these stories from these people who don't know any better. They just go to the doctor and try to do what they're told to do. We shouldn't have a system that's that broken, and we can do our part to change it. So thank you so much for listening. Subscribe to the channel so you get notifications anytime we go live and anytime we upload new videos. My passion is teaching it to practitioners and teaching it to the public. And we're going to be putting a lot more videos out there. And we're going to talk about the strategies, the choices that you make, what you eat, the timing of what you eat, and how you perceive it, the attitude with which you eat. So thank you so much for being here. And I look forward to seeing you on the Practice Transformation Workshop Series, the Practice Transformation Workshop Series that starts on September 21st. And if you miss it and you're watching this video weeks later, no worries, still click on the link and you'll be able to get access to it as a package or recorded package for very little investment just to cover our costs. Thank you so much. Have a great one.